Hi everyone, it's Dr. Maxine Szramka here, the rheumatology doctor. Welcome to my world of rheumatology. I love rheumatology and I make no bones about it. I have no secrets about it. I absolutely love it. I love this field of medicine that I'm in, and I feel completely blessed to be in such an amazing field working with the people that I work with. Loving what you do in medicine is often not something that we really talk about, but I really love it, and I want to share with you all of the things that I love about rheumatology. So, first of all, it starts with the people. I love the people. I love my patients. I love the people that I see. I love the conversations I have with people. I love the relationships that I have with people. And for me, that's where it all begins. And then for me, I get immense joy and immense satisfaction from understanding where people are coming from, what's affecting them, how they're feeling about things, and supporting people to express exactly what it is that's been happening for them. Often in rheumatology, we see people with very, very complicated histories because the nature of what we deal with is very complex. And often the type of people that get sent to see us are the ones that have seen a lot of different people and they haven't found any help anywhere with what they've been experiencing. And sometimes the histories and the duration of symptoms are very, 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 very long. And it can take time to understand what's been happening and perhaps when that started. One of the things that I really love is talking to people and developing foundations and platforms of understanding as to what's happened, when it happened, and what's actually going on now. One of the really important things in medicine and in rheumatology and in medicine in general is making sure that we understand each other. So in medicine, we have a very, very specific language. We have very specific and very precise training in physiology and anatomy. And people who haven't had medical training understandably don't use the same language that we use in medicine. So one of the things that I love doing is making sure that the language that someone is talking to me in matches my understanding of the word. So for example, what do you mean by the hip, the back, the neck, the shoulders? Because each person has a different understanding sometimes of what that word actually means for them. And understanding exactly what's happening gives the foundation for what might be actually going on for somebody. And I love working with people to develop an understanding and then develop precision of where we're going to go from here. So one of the things in medicine that's foundational is the talking. And some people say talk is cheap. And I say, well, it depends maybe on what you're talking about. But actually, one of the great skills in medicine is in eliciting an understanding of what's going on through the conversation and through observing what's actually going on with someone. It's a huge art that goes to it. And often in medicine, we make it look easy. It may seem like it's really, really quick, but that actually comes with a long, many, many, many years of training and understanding and learning, both on the job and then also from the books as well. So what I love is sitting down with someone and saying, okay, so this is happening. This appears to be what's going on. And I particularly love dealing with the musculoskeletal system and supporting people to understand what's going on with their pain, why they might be in pain, and how we're going to investigate it, and then how we're going to treat it. And each thing from the conversation to examining someone to organizing investigations to following up the results of the investigations and looking at things in stages and then talking about treatments, for me it's a magic. And each phase is super, super important. And each phase gives a clarity and a new clarity on what's happening. Sometimes in rheumatology in particular, we might not have a very clear understanding or medical reason as to what's going on, because often people see us with unusual symptoms that don't quite fit in any diagnostic box. So as a person who's seeking help, we want a label because we want to understand what's actually happening with us. And we feel satisfied when something about us has been given a name. That gives us a satisfaction and an ability to cope and then go on, because at least we know what's happening. I love doing that. I think that's amazing. One of the other things I love to do is describe what's happening and then work with people stepwise as to what steps we might take to deal with this condition. One of the most disheartening things as a patient, I feel from my experience, is going to someone and them not knowing what's going on with you, and just you feel completely dismissed because they say there's nothing wrong with you, because it doesn't fit what they understand about things that might be wrong with people from a medical perspective. As a physician, I feel it's really important to listen to people and understand what they're experiencing. Because if someone's seeing a doctor, you don't go and see a doctor unless you're not feeling right in your body. And that by virtue in and of itself means that something is not quite right. Whether we may have a known medical explanation for that is another matter. And I see it as my responsibility to work with people to come to the deepest possible understanding of whether a condition may be rheumatological or whether it might not. There's a vast number of things that my specialty covers, from arthritis to immune diseases to understanding of pains, understanding of muscle inflammations, and there's a lot of things that can affect people, and it's a vast pool of knowledge. And the other thing we do is we assess things from foundational understandings of what might be going on in terms of anatomy and physiology when symptoms don't quite exactly tie in with what we've been taught in medical school or our training. We always need to be open and astute and alert as physicians, because we have a vast pool of knowledge. But life, health, and illness and disease is constantly changing, and new conditions become known or studied about as time goes on. And often those conditions only become understood through the individual experience of a physician with their patients, and then the collective experience of many physicians with their patients. And for example, celiac disease, its association with wheat, was only diagnosed, I think it was after wartime, when a physician noticed that his patients who had gut symptoms, they got better in the war when there was rationing. And then they got worse again after the war when bread returned to the market. And I understand that he astutely observed the link between bread and symptoms of celiac disease. And that's how the association was learned. But up until that time, it wasn't completely understood. And that's one of the amazing things that I love about rheumatology, is learning new things. When people come and see me and they express to me what they're experiencing and what's going on for them, I actually find it really fascinating. I find it really interesting. Sometimes it can, as a physician, it can be frustrating when you don't have the precise answer for somebody, or it's not immediately apparent what can happen. And I think these things are human and it's natural, because as a doctor, we want to help people. We want to be able to find the answers, and we want to be able to provide things that can help people, because we don't like to see people in suffering. And that's actually why most of us, well, I went into medicine with this deep feeling of wanting to contribute, wanting to give back, wanting to basically do what I can to really help people. And for me, when I was young, I remember tossing up what I was going to do, whether I was going to do law. When I was young, I was always playing the doctor. I was never the nurse. So I was very clear from a very young age that I was going to be the doctor in all those games. And I remember in grade 5 feeling pressured that, or grade 6, I felt pressured. I had to make a decision about what I was going to do. So I said, I'm going to be a doctor. And then I remember later on in life, I remember thinking, gosh, but what if things go wrong? You know, it's bad. If people get sick, you can't fix them, or there are problems. I thought maybe you should do law. And then, mentally all these things go through your head, and there's so much pressure in the HSC. But ultimately what it came down for me was a deep knowing inside that I was here to be a doctor. I was here to be a physician. And I loved the idea of being a physician, being someone who understood life and saw how people sat in the context of life as a whole, and being able to offer a wisdom to people and a vast breadth of experience when they come to see me, and to be a doctor who's actually part of a community. For me, I always saw being a physician as being part of a community, being a part of life and not separate from it. And I'm a rheumatologist. I'm now a specialist. I had these images of, I think it was country GP or country physician in those old days, but that doesn't exist so much anymore in terms of physicians. You have GPs, yes, and they do such an amazing job, and I absolutely love what they do. I think it's phenomenal. And I think still for me as a specialist, rheumatology is still about being part of community. It's about being with people. It's about understanding people. It's about understanding the body. And it's about applying treatments that are very, very appropriate to what's going on for a person. And I could actually talk for a very, very long time about what I love about rheumatology because it's unending. We now have amazing treatments for conditions that 10, 20 years ago completely crippled people. We had ankylosing spondylitis, rheumatoid arthritis, different forms of inflammatory arthritis that completely crippled a person in their lifetime. And in the last 20 years, we've had the advent of amazing tablets that really, really help people. And we've had the advent of biological drugs, which have completely transformed the life of many people whose arthritis does not respond to the usual medications. And it's an absolute joy being able to work with such remarkable developments, to be able to support a person in their health, to know that if they respond, they're going to be able to lead amazing lives. When I was a medical student, we saw crippled people in hospital from having had long-standing rheumatoid arthritis. But now that is such a rarity because most people respond so well to eventually some drugs, combination of drugs, or the biologicals. It is so rare for people not to respond or not to be able to tolerate any medications. And I'm actually excited about the prospect that we will have new advancements that help people with their different forms of arthritis and their immune connective tissue diseases, because research is being done all of the time. And the more we learn from our patients and the more that we share that, then the more we can work together to provide the best possible support for people in the healthcare for their rheumatological needs. So I'll leave it there. My passion for this specialty is absolutely unending, and I'm going to share more of that with you when I talk about different rheumatological conditions and answer some commonly asked questions that I get to see if we can make it simple. Thanks very much for listening and have an amazing day.